Hello everybody, Eric Wilson with iSell Health Incorporated. Wanted to kind of talk to you today about the difference between healthcare, and health insurance. We had this big healthcare reform law that's about to kick in, and they call it healthcare reform, but we didn't really reform healthcare. We reformed health insurance, and I think the whole thing is kind of needs to be looked at in different categories. So first of all, let's look at our health. Health is us, our bodies, you know our how we live, our lifestyle. And in this country, we are maybe not the healthiest nation. We are 28% of this country is obese. Obesity can lead to diabetes and heart disease and high blood pressure and cholesterol, which in turn has to be treated with either heart surgery or cholesterol medication or blood pressure medication or type 2 diabetes medication. So that again is a derivative of the health. All right, that's just one thought. Now we talk about healthcare. Healthcare is the treatment you get from the hospital and the doctors, right? And our healthcare system is one of the best in the world. From that side of things, we have people coming from around the world to get treated here. People in Canada will come to the States. They get their free healthcare up there, but we have known people that come to the United States to get treatment. Also, when you look at the survival rate in this country, I look at cancer as a big statistic. The average 5-year survival rate of cancer is 66% of men survive cancer more than 5 years, compared to 47% of European countries. So I think that is a significant thing to look at. They say, well, the mortality rate, people die younger in this country. That's a little subjective because some countries don't count, and as tragic as this is, infant mortality uh, in their statistics. The United States does. So I mean, a lot of countries do, but Poland does not, Czechoslovakia does. I don't think France does either. Or if the baby is like less than 500 grams, I believe it's not counted. So I think that's a subjective number when you look at that. Okay. Uh, Health insurance. All right. Health insurance is what pays for your medical bills. If you have insurance, if you don't have health insurance, then you pay for yourself or you file bankruptcy. Now, if you file bankruptcy, who takes a bath on that is the person who provided the treatment, the hospital or the doctor or whomever. So that's part of the problem. And they say, you hear people say, I don't have health insurance, I don't need it, I don't get sick, I don't go to the doctor. Well, that's right. I do have health insurance, and I really try to avoid going to the doctor as well. Uh, I've had that until recently. I had not been to the doctor since probably 1995. I did go recently for an injury, so now I'm like everybody else. Uh, but I think having health insurance, I say, part of the new healthcare law gives what they keep calling it free preventative care, but it's built into your premium. It doesn't mean people are going to go to the doctor anymore often. I think having health insurance doesn't necessarily make you healthy, just like having auto insurance doesn't make you a safe driver. Uh, I think if you can practice preventative, you do the right thing, then maybe if you just eat better, take care of yourself, you may not get sick. There's also studies out there with chiropractic. If you see a chiropractor and your spine's proper, then you don't get sick because the spinal curve, the central nervous system kind of cures everything there. So there's all kinds of statistics on these kind of things to where to look at, but. Uh, Back to the health. When we were kids, we were always outside playing. Now kids have their Xboxes and their video games. I'm looking at you on a computer right now, and there was no computer when I was a kid, so I couldn't spend any time in front of the computer. So it's a different world we live in. So I think people don't get as much exercise. So I think, as I started to say earlier, our eating habits aren't great. I think people are overweight with the obesity. I think they exercise less just by the nature of life, and we're a busier society too. I mean, people work more hours. Two working family, you don't have time, you don't exercise as much as a person because you're working more and longer commutes to work. There's various reasons for that. People have 60-minute commutes. I live in the Chicago area. You can't get anywhere out here in less than 45 or 50 minutes. So to do that, going each way, when you have time to exercise, I get it. You know, uh, so that's derivatives of your health. Okay. Health care, the hospital that takes care of you, their costs are high because one, we have better doctors. Two, there's things like medical malpractice insurance you have to have that's expensive. That's a small percentage, but it is some. We got more expensive medications. That affects things a little bit as well. I think there's more preventative care because people are afraid of getting sued, so they need to run some unnecessary tests. So that's part of it as well. That's not the whole problem, okay? But all those things cost money, so your health insurance costs more. Because you got to pay for the insurance company's paying for your blood test and your MRI and your preventive tests here and there. Okay, Then there's also the uninsured, okay? And that's what the whole purpose of this healthcare law was, to try to cover the uninsured. Now, we went about this a little bit wrong, in my opinion. There's about 15% of Americans that were uninsured, right? And that's a high number, don't get me wrong. But not all of them were quote unquote uninsurable. A lot of those people chose not to have insurance. A lot of people were the 25, 26-year-olds who don't get sick and didn't have insurance. There's also people that just choose not to buy insurance because they think it's a scam or a ripoff or whatever. So, and there's people then I'm sure there's people that are just independently wealthy that self-insure themselves as well. So, I think, if we looked at how do we cover the people that need insurance that are sick, that's one thing. We looked at putting everybody into it and penalizing everyone. So in this country, I think everybody is in the healthcare system in some way, because at some point you're going to break a leg or pull a muscle or get the flu, or you know be in a car accident that's not your fault necessarily, but you end up having to get treatment for whatever reason. So I think there needs to be a way to cover everybody, but look at that. But the other thing is we have the Emergency Medical Treatment Act, EMTLA, that says you have to get treatment in the emergency room regardless of your ability to pay. The problem with that is people don't pay. If they file bankruptcy, like I said, that's bad for the hospital, or they just don't pay. They get a charity case, which again, that is okay. But if they got rid of that law and force you to pay, maybe more people would buy insurance just in case. So I'll just go to the emergency room if I get sick and whatever. So just a few thoughts there. I want to try to clarify that you got health insurance, and health care. They're all kind of different things. So we have to look at that separately, not just as the insurance company is evil or the healthcare system in this country is bad. And you have to look at the total picture, and it's more complicated than just health insurance is bad, or we don't have good health care in this country, or health is bad, or we're not healthy people. I think you have to look at the entire package to determine how to fix it there. So either way, that's my 7-minute take of the day. Have a great day.